Tandem HR.
Exceptional workplaces.
Exceptional people.
Good afternoon, or just afternoon, everybody. This is Sam Cashy. I am the Director of Business Development and Strategy at Tandem HR, and we welcome you to our webinar on an innovation in healthcare called the NorthShore Complete Care powered by Humana network and solution. Today, our webinar will cover a few highlights on this program for about 30 minutes. We'll have Ben Frisk of NorthShore University HealthSystem discussing the capabilities and the NorthShore Health System. We'll have John Hartz of Humana talking about the collaboration and how Humana is actually making this work for employers. And I'll speak a little about Tandem HR and how we are bringing some innovations ourselves to the medical marketplace. So in terms of overview, the highlights that we're hearing from our clients are that employer-sponsored health plans costs are ever escalating. There are a few anomalies of reductions, but in general, the cost trend line is maybe it's not quite a hockey stick anymore, but they're going up. And what do you do in those things? You can either maintain or you can look for innovation. What is happening with NorthShore and Humana is that focusing on a strategy of working with businesses located in the northern Cook County and Lake counties now have access to a very unique option, which we'll discuss today. And with Tandem, we are working to help employers gain access to pooled medical programs that provide a strategic opportunity to enhance cost control while maintaining benefits with the whole initiative to attract and retain great workforces. Today's objective is to provide a brief overview of this opportunity and then share our next steps to actually see if there is a fit within the groups and the employers that we are here and the program. So with that, I would like to turn this over to Ben and to the NorthShore University HealthSystem team to talk about their business, and we'll go from there.
Thank you, Sam. Thank you, everyone, for participating today. This is an exciting time and also a very confusing time in healthcare. A lot of this is related to the Affordable Care Act and what's going to happen there with public exchanges and whatnot. And a few years back, we started having conversations with Humana around why aren't we doing something unique in the marketplace, create what we are calling a micro network, which is specific to a health system and their provider network, and try to offer employers in our service area an opportunity to have access to a high-quality system with excellent results at a favorable price. So now here we are today. We're out in the market. The state's approved the plans, and I'll let John Hartz talk more about that, and I'll focus more on a NorthShore background. So my role at NorthShore is the Assistant Vice President for Business Services. So what that means is the lead on the managed care and commercial relationships with all the health plans, and I also have day-to-day oversight for our clinically integrated IPA, which is currently managing 40,000 risk lives with a Blue Cross Blue Shield relationship. So enough about me. Let's talk about NorthShore. We're a 4-hospital system with a robust research institute, more than 1,000 office locations for our medical group. 2,000 physicians overall are on our professional staff. Of that, 800 to 850 are in our employed medical group, and we're nearing 10,000 employees throughout our system. We are the principal teaching affiliate for the University of Chicago Pritzker School of Medicine. We provide approximately $250 million in annual community charity benefit to the area community, and revenues are around $1.7 billion. Our guiding principles are patient-centered, integrated, data-driven, distinctive, and innovative care. So it's a matter of coupling our expert medical care with our expansive and comprehensive systems that we've put in place to really create best practice scenarios. Again, we have 4 hospitals, 100 medical group offices, and an advanced EMR that's been nationally recognized. Our clinical informatics are evolving, and I think in the near future, folks will really get a sense of what we're doing in that space and how that will position us to be even stronger in the future, which then, of course, ties back to how do you do data mining techniques to, say, reduce infection rates or standardize spinal fusion care, things we're working on. In terms of some of our accolades, we've recently been recognized by a group called HIMSS, who looks at EMR integration throughout a system. And we are the first in the country to receive what they call a Stage 7 award, which is the most fully integrated EMR that they've seen in the country. So I think that speaks volumes. We're ranked in the top 10 by Thomson Reuters as one of the top systems in the country, and also the Top 100 Hospital Award has been received 15 times. When we receive those awards as a quote-unquote hospital, it's based upon our entire system. So if one hospital caused us to not make it, we wouldn't be on the list. So this basically means all 4 hospitals are of the same quality and are truly integrated in how we're delivering care. Our quality scores are in the top percentile nationally. Our nursing program is magnet designated. We were the first hospital system in Illinois to be recognized by the Leapfrog Group. And in recent health grades reportings of America's top 50 hospitals, all 4 of ours were on the list for Illinois, and I think in total there were 6 Illinois hospitals listed. So heavy percentage of those were our hospitals. A little bit about our medical group so you can get a sense of our geography. We span from some locations down in the Loop all the way up to Gurnee, then with a heavy concentration of offices located near our 4 hospitals. Again, we have a fully integrated EMR with our medical group and our 4 hospitals. We have a patient portal that we refer to as NorthShore Connect. This enables patients to communicate directly with their physicians. You can review lab results. You can ask for prescription refills, so you don't have to go into the office to get a prescription refill and pay that copay or any of that stuff. So what we're trying to do is make access to the physicians easier and reduce potential office visits and therefore spend for employers. We have a full range of specialty services. We also have evening and weekend hours. We have Saturday office hours, and on Sundays a couple of our sites have walk-ins, I think from 8 to 11 in the morning. So what we're trying to do there is prevent a visit to an urgent care center or to an ER due to something that's happened over the weekend. I think another benefit for employers is 30 to 40% of our medical group office visits are scheduled same day. We actually set time aside so people can make same-day appointments. So if there's an urgent situation that does not require an ER, you can get in and see your doctor. And if for some reason your doctor is not available, someone in their practice will be. And due to the EMR, they have access to everything that's going on and can communicate with that person's PCP. The next slide, I want to talk a little bit about some of our niche services. Again, we're not just a community-based hospital or community-based system. We're an integrated tertiary delivery system with a niche on our Kellogg Cancer Care Center, which is nationally recognized. We have a robust neurological institute, strong orthopedic and cardiovascular care. We also, and it's not in these slides, have a relationship with the Mayo Clinic where we're part of the Mayo Care Network. And anytime we need a second opinion for a cancer case, a cardiovascular case, or a neurological case, we can connect with the specialists up at Mayo and get their second opinion, and that is all actually free of charge for the patients. It'd be part of the physician service that we are delivering. And then just kind of a quick snapshot of what we see as the patient experience at NorthShore compared to our two primary competitors. In terms of looking at this graph, 60% of our patients feel their physicians are answering their questions and addressing their needs, compared to our competitors are at 40%. And then obviously you can read the rest of the graphs in terms of treating patients with respect or like a person and feeling like a partner. Well, we're not at 100% imperfect, and it's something we're working to evolve. We are better than our competitors for the patient experience. And that concludes my portion.
Ben, thank you very much. Congratulations, and keep up the great work. It's definitely a challenging but super important part of our economy, and it's great to be working with a leader in the area here. So I'd like to transition now to our team at Humana, who will explain how the NorthShore and the Humana program come together with NorthShore Complete Care. And with us, we have John Hartz.
Thank you. My name is John Hartz. I'm one of the sales leaders here at Humana, responsible for the distribution of Humana's products. And we're extremely excited to have this opportunity to bring the NorthShore Complete Care product to you, powered by Humana. I think it's innovating and cutting edge when we're going into the 2014 healthcare reform. But Humana as a company has a broad network throughout the state of Illinois and even nationally. But when you really look at what we were trying to do that was unique and innovative, it was to leverage a partner that has taken the step to be fully integrated and patient-centric. So those were two of the key things when we really looked at adding value to the Humana organization, but also to our client base or our potential client base. It was a partner who was cutting edge, innovative, but also had some quality metrics behind it that over time would bend the cost trend. So what is NorthShore Complete Care? When you really look at what we've created here, it's an HMO product in a microscope in the North Shore area. It covers demographics in northern Cook and Lake County. It can be coupled with our PPO product to offer a broader reach if there are employees that aren't in the North Shore location. But I think one of the key things when you really look at it, and it's probably very advantageous on the front end, is it shows a price point that's about 10% below our broader HMO network when you look in the marketplace. So when we really look at, I don't want to focus too much on the initial pricing, although I know it's extremely important. But when you looked at why we did this with NorthShore, there's a few takeaways I'd like to hit. Again, as Ben talked about, NorthShore HealthSystem has 4 main hospitals, has a physician network that employees will have access to. But when we really look at what we're trying to do for the patient or the patient experience, it's that integrated delivery system. It's localizing the healthcare, but also when you think about it, patient-centric, or really catering to the needs of the healthcare delivery system to not only our members but to the employees of your organizations. That's key in the changing world. The quicker that people can get seen, or the easier the experience is, the better outcomes that we're going to have over time. One of the key things that we see is, same-day appointments, evening and weekend hours that NorthShore has, which will not only be advantageous from an ease of use, but will also hopefully drive down any emergency or urgent care visits that your employees might have. One of the other key things when you look at it from a Humana perspective that feeds nicely into what NorthShore has done is our focus on wellness. Keeping people well is first and foremost. Humana has a lot of capabilities within our programs on a fully insured basis. One of the key things is our Humana Vitality program, which is a wellness suite of products which will help employees understand where they are today, with their health and well-being, and gives them outlets and tools to better or to engage more fully with their health. In addition, when you look at that, people who do need to seek care or are identified as having some maybe leading indicators to behavioral changes, those individuals have access to NorthShore. As you saw, they have a very robust suite of services. But I think the key thing is the integration that they have between their physicians and the facilities that they employ. But when you really look at NorthShore, and probably what is most important to highlight on this call is the employer advantages. Some of the things that we're going to be doing is just the increased communication and efficiency with the patient care. Again, can't stress enough of the integration that you have, but also the quality metrics that NorthShore has shown in the marketplace. Not only will, over time, control the cost curve, but will really be instrumental in the engagement of your employees to their own personal health. I mean, the lower health cost premiums that are occurring in the marketplace today, you know, this 10% advantage on the front end gives you an ability to put a price point or an option in front of your employees that will drive them not only to a quality network, but will give them the options that they need to take care of their families. And then the attractive product offerings. Again, we're looking at, you know, the HMO purely from, you know, a medical standpoint at this point, but some of the wellness packages and programs that we have at Humana can be highlighted for you, the employer, to show your employees that they are with a quality carrier, that carrier has a very robust partnership with a extremely well-recognized health system in the NorthShore area, and will hopefully lead to better retention or recruitment for your employees.
Great,
but with
John.
that, I'll stop and turn it back over to Sam.
Great, John. I appreciate that fantastic overview. We're collaborating together to help employers address a few trends in medical insurance and human resources. First, the Affordable Care Act is adding complexity and are really going to change some of the general procedures that are going to happen with first smaller groups, and then as the Act goes into later years, larger groups. And so some of the implications, early implications, and we have to get a little further into the data, but community rating is going to be, for smaller groups, is going to have an impact for employers whose workforces are on the younger side of the cost curve and just the labor force. Pooled programs are a trend that are providing a equal playing field for entrepreneurial and mid-sized employers to compete with large companies who they compete with every day in the marketplace, but may not have had the resources internally to control costs and control risk. That is a nice competitive advantage. And then one sourcing. Many of our clients and many companies I work with, they're trying to simplify who they do business with and how they do business, and gain leverage and efficiencies from finding strategic partners that transition from having multiple vendors to one team of experts that are committed to helping them achieve their mission. So what is a pooled medical program? Just highlights most current employer-based insurance policies are single employer policies. Tandem's Humana pooled program allows employers access to a multiple employer program. We have about 25% of our clients in one master medical pool, and we work with around 200 businesses across the Chicagoland area and nearly 10,000 employees. What does that do? It diversifies risk. You've got a larger pool of employees and employers in the pool, so you're managing where one firm may have challenges one year and other firms don't. You work together as a team. It creates the larger premium pool and historically has shown annual increases have been increasing at a slower rate. And employers that offer multiple plans are allowing employees options to make choices. Having a variance of HMOs, PPOs, high deductible plans together give the employee choices and the employer some flexibilities in an amount they'd want and can invest in typically what is a major part of the overall economics of any business. So what is Tandem HR doing for our clients? Well, we're bringing some unique expertise to the entrepreneurial and mid-market companies. This is a quote, an email I received yesterday from one of our clients where HR is a complicated business. Employment and all the things, payroll taxes, benefits administration. You can have Google, you can go out and find your own answers. Or you can go to a team of dedicated professionals that know you, know your organization, and will be there efficiently for you, not only to research the issues, but follow up until there's full knowledge and actually there's a way to move forward. And so we're very proud. I'm proud just to be in front of a great organization and know on a daily basis that we're making a difference. We're Chicagoland centric. We believe that we can make a difference, and we really have an attitude of servitude at our company. So why Tandem and what are we doing? We've been in business for 15 years. We're really helping employers create great workplaces. We're doing the things that have to be done but weren't why people started their own business in the first place. We want to deliver value to our clients. We're bringing expertise and we're bringing some economies of scale and purchasing power that's just not available for small and even larger 200-300 person companies. And that allows our clients to focus on what's most important to moving their big businesses ahead. How do they stay competitive with larger and newly emerging competitors? Here's a complicated slide because employment is complicated. You've got payroll and payroll taxes. You've got compliance, workers' compensation, benefits and benefit strategy, a 401k, employee relations and employee development. You want to understand, are you compensating employees competitively? All these things are what we do as a one-stop shop for our clients. It's a real simplification. If you think about how businesses are run today, on a payroll basis, you have a payroll company. You often have a separate 401k financial advisor. You've got a different insurance broker for a benefit program and for workers' compensation and those processes. You may have consultants or lawyers to go to for employee-related challenges. All that is time and energy that your management team is investing where they may have a higher, better purpose of their time and having a partner available, and that's why our mission is so fun to do and brings, because we're really making a difference in our clients' businesses. So some of our differentiation, we are providing strategic benefit, employee benefits, pooled programs, efficiencies, not only in medical but in other areas like 401k. We provide our clients a dedicated HR services team. Instead of having a call center approach and calling overseas or calling to an out-of-state provider, we're local. You have the same HR team dedicated and get to know your people, get to know your businesses. A lot of things happen with our consultants that aren't even coming into the front door of the owner, the offices of the owner, or the executive team, because we become a trusted advisor of your employees and your supervisors and your managers. We're transparent and flexible. Depending on your capabilities and your needs, we can mold and be accountable accommodate our model to you. We're not trying to just one size fits all every company. And we provide financial security. The ESAC is the FDIC of our industry. Most employers, the biggest expense is payroll. And to have the confidence that whoever you're doing payroll with, you have a surety bond, and they have internal controls and processes out there is critical to make sure that you have the financial security as a business owner to know that whatever funds that you're transferring are protected and your business is not at risk. So it's an exciting time to be helping companies with healthcare and with the challenges and helping them also build their businesses. We believe that the entrepreneurial market in Illinois is going to be the engine of growth and opportunity, and we are happy to be a business partner. And so follow-up questions and information, please email us at simplify@tandemhr.com. Give us a phone call. We'll be happy to share what we know and become a partner. Pleased to have the opportunity to be a partner. So thank you to Ben and the NorthShore team, and thank you to John and the Humana team, and I wish you guys all a great afternoon.